Can we start with the psychology?
Sure, sir.
I think
you started. Yes. Morning, everyone. The title of my thesis is Incidence of Postpartum Depression and Associated Risk Factors in Antenatal Women, a Cohort Study. The protocol presentation was done in May 2021 and data collection was started from June 2021. And my sample size came out to be 100, and up until now I've taken about 50 patients. The introduction has been written, review of literature, the articles have been compiled, aims and objectives have already been mentioned in the protocol. The methodology has been mentioned in the protocol, and the results discussion is awaited.
So how many screened participants?
So out of 100, sir, I've taken 50 and followed cohort study. So I was supposed to follow them 2 to 3 weeks after delivery, post delivery. So I've followed 7 patients till now.
Including dropouts also, or just?
Yes, ma'am.
Completed 50.
Yes, ma'am. 50
no
completed. Not till now, ma'am. क्योंकि वो follow up पे ही पता लगेगा if they are coming back for the hospital visit.
Any fixed follow-ups?
Sir, 2.
So 50 patients are completed over the
Not 50 patients, sir. Abhi 50 patients have taken the data antenatal based on the expected date of delivery. After that, sir, after 2 weeks after that, I'm supposed to ask them for the development.
I think in October you'll have to submit it.
Yes, sir. So my patients, the protocol says that my patients should be from the 3rd or the 2nd trimester only. So I'm not going to go beyond July.
1 month.
Sorry, sir.
The seniors, they've got an extension of a month.
Yes.
This time I'm not sure whether
Yes.
get the extension. That is what was discussed on the meeting, so you have to be.
Yes, sir, sir. That is being taken care of. Ki,
And
nothing, no
ready all
EDD
your
beyond.
stuffs, be in touch with your guides.
Yes, sir.
And start handling this introduction.
Yes.
methodology,
Yes.
So that those are verified.
Yes.
Results needs to be put in, analyzed,
Yes.
and discussion needs to be. So these
Yes.
2 factors will be.
Yes, sir. So the one thing that is being taken care of is that no expected date of delivery beyond July I'm taking, because after that I will have to start compiling. As of now, I've done my introduction, the review of literature, the articles have been screened, and that is the review of literature has been. Yes.
To put up a paper, because we don't know NMC now it is asking submission. We don't know that next year in batch it asks for paper.
Okay.
So,
Yeah. Sir, within 6 weeks देखना है उसको, तो या तो if they have an admission for मतलब extended. Yes, so that's what I'm saying. I'm not beyond July. Then I'm taking the patients in the 3rd trimester only.
Protocol can't be done. Protocol is logged in. So she has to go over to the protocol. Even if after deadline she couldn't take any sample, it's up to the guides. Take a stance, whether she has to progress with the limited sample size. If she is having, you can't change.
Even if they don't, some of them don't turn up for follow-up.
Yes.
You will take it as dropout.
Yes.
Add it as a dropout.
Yes.
So just be in touch with the guides.
Yes.
Any issues with the knowledge.
Sure.
Take it and screen how many participants were screened also needs to be put into the process. These were screened, these couldn't fulfill your requirements. So
Yes.
why?
Okay.
So that is what the consort, Prisma, everyone wants. Whatever comments you have made, you also write that.
Can you find it? You don't seem fine.
Psychologist was the last
Because
one.
that's weak.
Good morning, everyone. Good morning, ma'am. The title of my study is Efficacy of Injective Theta plus Transcranial Magnetic Stimulation and Bipolar Depression. It is a randomized placebo-controlled study. Total sample size of the study was 40. 50 patients of bipolar depression was screened as per inclusion criteria. 5 patients were excluded because they didn't give consent, and 5 patients dropped out of study. So total 40 patients completed the study. As per UGC regulation 2009 amended in 2016, we have to present 2 papers in conferences or seminars. So I have presented 2 papers. In first was in 46th National Annual Conference of Indian Association of Clinical Psychologists, and second was in 43rd Annual Conference of the IPS Central Zone. For publication, I have submitted my first paper in the Journal of ACT. It was submitted on December 25, 21. Then resubmitted for editorial review after editorial review on January 21. Now still waiting for response. Second paper was in Journal of Psychosexual Health, submitted on January 8, resubmitted after editorial review on 20 February, but waiting for response. The second paper was not in the UGC care list, so I'm working on a next third paper. Manuscript have been finalized and analysis have been done. So just doing work on it. Thesis writer, introduction, review literature and methodology part is written and reviewed. Working on analysis and results part. Discussion and conclusion is still remaining.
What is the deadline?
And deadline is of May 31st.
May 31st.
So the status, I mean,
Ma'am,
that is the only thing that
I'm waiting for the acceptance of the paper, and writing is still going on. Worked on analysis has been completed. So working on result and discussion part.
Mid-April.
Mid-April.
This is mid-April.
Yes.
Within a week, you hand over the rough draft of the
Yes.
thesis.
Okay. Sir.
That is in your
Oh.
hand. Submit, write the third paper. Submit it, because then when you submit, the reward is not in your hands. How much time do you take?
Yes.
and then we can say that you know, that you're and you're waiting for their
Oh.
But you have done well. You've been very proactive. Whatever you were doing. Unfortunately, your second paper was not.
Yeah, yes.
Journal was not in the list.
Okay. Thanks.
Any comments? Anyone wants to ask something? You can ask. Paper.
Good morning, one to all. The title of my thesis is Efficacy of CBTI for Insomnia and Schizophrenia, a randomized controlled trial. The total sample size of my study was 40. 7 patients dropped out of the study and 40 patients completed it. We analyzed our data by using the SPSS version 28. Our main analysis was intention to treat analysis, including all the patients, irrespective of whether they completed the study or not. A supplementary per protocol analysis was also conducted. We concluded that the CBTI has a significant improvement in the insomnia and schizophrenia. As my thesis, introduction, review of literature, aim and objective, methodology, statistical analysis, table and results done. Still, the discussion and summary and conclusion, limitation and future direction is under process. As per as UGC regulation 2009 amended 2016, presentation of 2 papers in the conference or seminar is mandatory. I have presented a paper that is on 46th National Annual Conference of Indian Association of Clinical Psychologists, and the second paper is accepted and presentation is scheduled for 5th May 2022. That is in Jindal Institute of Behavioral Science, OP Jindal Global University. And the publication, and for the publication, 1 paper is ready and given for review to the co-guide. And for the second paper, the manuscript is finalized and analysis is going on.
Again, you have to be more proactive. Dr. Costa will help you out, as he has experience in sleep papers. So you need to pass track. Okay. and you have to actually go for any Scopus index, any number index, at least any Scopus index paper. So we have to actually put it on.
Good morning to all. The title of my thesis is Effect of Cognitive Behavior Therapy on Neuropsychological Profile in Schizophrenia with Insomnia.
Go to the update.
Protocol was approved by Institute Ethics Committee and is considered
Go to the update.
Just
Where's the-
sample collected photos and
So you have finished the study on the.
yeah. So let me start from sample
No.
size. No,
Just one. Where is your
I
study?
think only two
Thesis.
slides were required. One, the progress of your study and your publication. That's
so
it.
the data was collected on all the 40 samples. The result was within the active group, except for writing pathognomonic subscale and WHO quality of life brief, all the other clinical measures did show significant improvement with CBTI. When compared for the effects of time across the two groups,
No, no,
as
we
per
don't want
protocol
this.
analysis,
Where is your data? Where is your study currently?
introduction,
Thesis.
introduction, literature review, methodology, statistical analysis, table and results have been completed. The written part of these chapters have been completed. 3 conference presentation was done. 1 research paper submitted to Asian Journal of Psychiatry and is under review process. 2nd research paper is yet to submit. Most probably, I am going to submit it on Monday.
Any journal you have selected?
Um,
You discuss it.
okay,
Discuss it.
yes. Thank you.
So my topic is comparative study of quality of life, psychological well-being and coping strategies in reference to meditation among individuals with alcohol, cannabis and opioid addiction. From March onwards, I started collecting the data and I have done the pre-testing on 30 patients from each group, 10 from alcohol, 10 cannabis and 10 opioids, and I'm daily going there for the sessions. And after completing that, I'll be collecting their post.
How many samples have you done?
120, 60 control group and 60 experimental. So 13 each group I have done the pre-testing sessions I'm giving to experimental group, and after completion of 45 sessions in 45 days, I'll be doing the post thing. And side by side, I'm also writing the introduction and literature. Okay.
Good morning, everyone. The topic of my thesis is efficacy of adjunctive theta burst transcranial magnetic stimulation in acute mania. It is a randomized placebo-controlled study. Protocol was presented at the ethical committee in the month of May. The protocol was approved by the Institute Ethical Committee.
People who have presented can leave. They want to.
The study was then registered by CTRI. Clearance from CTRI is awaited. They have asked for clarification, which has been sent. Pilot data collection has been started to check the feasibility. My sample size being 40, I have taken 16 patients, out of which 2 patients have been dropped out. So it's a 16 patients. So 2 patients have dropped down. So 40. 2 patients have dropped down. So 1 patient crossed. So active is 10, placebo is 6, out of which 2.
Why don't you start writing pilot study?
So CTRI,
CTRI.
that is.
So CTRI, why it is so
So
delayed?
the clearance, they asked for a clarification because of the upper and the lower case.
Why did they ask for clarification so late? What's the thesis? So resident pieces, time based, delay होगा तो कैसे? So now they have reverted.
No, sir, we have sent it to them, but they haven't replied.
You have to go and check it maybe
Yes,
every
sir.
week because generally it is lost out in spam mails.
So the introduction and review of literature, I have reviewed the articles and I have started compiling it. The methodology and aims and objective have already been mentioned in the protocol. The results, discussion, summary, the conclusion and the bibliography will be done after the complete data collection has been done.
If you are interested, you can actually review the status of RTMS in bipolar mania, bipolar depression, then
Yes.
is
So I
why
can,
not bipolar mania. What is the status? You can work in sync with Costa and you have to go for hospital to register your. There is very less literature. You publish it side by side. It will not lead to a lot of fun.
so a review is like a paper or
Review is a systematic review, which possible. We need to go for case reports, case series, and your control trials, uncontrolled trials regarding RTMS in English. Hardly there might not be more than 10, 12 articles.
yes, sir.
It's a very good time to actually write that. And a brief report we can write it. Right? Brief review, get the options. So this is mid-April, maybe June, July, August, September, October. So 5 months to finish your data collection. And also you have to write down any dropouts. So what was the nature?
So one dropout was because of the patient.
Whatever is the reason to write it. You have to take a motor player. So that is very important.
So he crossed the motor
Any
agitation.
patient who wanted to enroll initially agreed and then later denied also.
Yeah.
In the sense why those patients were screened, why they were not enrolled. Any patient who was enrolled, even one reading was taken, you include them as an intention to treat analysis. We'll include them, take help of seniors, so they'll guide you. And then subsequently, after enrolling, they dropped out, so they'll become part of the study. So that is very, and you can write a file.
Good morning, everyone. I'm sorry for the delay. Ji. So, the work done and the work in progress. So, work done is like all these chapters have been written, and the one conference presentation is pending. One research paper is submitted, which is under review, and one research paper written, but it is not submitted yet. Also, we have done the statistical analysis. So results showed there is no significant. Okay. And the work in progress is like the pending presentation for the conference and research paper, which is submitted, but acceptance is awaited. Writing discussion, conclusion, and bibliography and extras chapters are pending.
How you go for this conference presentation?
So still looking for that. We're getting
whatever paper you have submitted, you can go and present it in the conference or whatever you're writing. You can present it before submission. People can be presented with many conference. But you have to do it very quickly. Not much time is there. 6 weeks, 8 weeks. You need to see whether any conference is coming up, apply and submit. Submit the abstract and whatever write-up is there, you won't present it. Because what issue with that? Submitting a paper in a journal after submission, I think it is not in our hands, it is in the hands of editors. You can call them, but they might not. At times, calling an editor to fast track the process even makes it more slow. They get even more paranoid. They will actually slow the process. That is what I experience. So quickly do it.
okay. Thank you.
Dr. Tanya. This copy will go to also this copy will go to principal. The minutes of the meeting, and type it, and then this copy will go to the principal and all the field.
My thesis topic is role of melatonin as an adjuvant in managing sleep impairment in opioid withdrawal patients. It is a randomized controlled trial. Thesis timeline, protocol presented at ethics committee in the month of May. Clearance from CTRI is awaited.
Why is it omitted? Again, same issue.
So, same issue, sir. The upper and lower case issue.
When they did they update it? Did we miss it in between or we saw it later?
No, sir, it came a few days back.
Achha, did I talk to the Dr. Jyotsana? You can call her. Ma'am, this is the issue. It's a thesis. You're not collecting the data. Please ensure that everything is fine. Plus, there was a trial registration letter.
So I have completed 20 cases, of which 10 are dropouts. My total sample size is 40.
40.
Yes, sir.
20 cases you have taken. 10 is
Taken
dropouts.
10 are dropouts. Sir,
I thought more would be dropouts. Maximum patient I saw.
They drop.
You have to drop them off. Whatever is a dropout, we need to include it. That is also data.
So introduction review of literature is being reviewed. Methodology and aims and objectives are mentioned in the protocol. And discussion, summary, limitation of future directions, conclusion, bibliographies after the data collection.
In Excel, after my the Excel, you can prepare it now also. In Excel, the data collections again. Only one direction might be there, your master chart. The next thing you can prepare. See, only the point is when you have collected your protocols, everything can be finished. Only result analysis, results analysis takes a day, writing results takes a day. Writing discussion might take a week. 10 days hardly work is left. And all the major references you will, bibliography you will encounter in your reviews, review of literature. Till then you can finish it. And when you have spare time. Any questions? Okay, thank you. Start with the rounds. Thank you.